damaged skin as much as possible. We want to stimulate elastin and collagen production in the face, and it'll reduce fine lines and wrinkles as well. So we're going to use an Erbium resurfacing laser today. It's also known as a YAG laser. It uses a special pixelated treatment. So what it means is like it does little stamps of where it penetrates all the way through the epidermis, and then it skips a spot and leaves it. So they call that pixelated, so it looks like a little stamp on your face. So it doesn't damage the entire epidermis because it'd be more inflammatory. So it does this pattern of pixelation improves the regeneration ability of the skin cells underneath it. They come from the dermis, not the epidermis. Make sense? So that's what we're going to do. Take a look at her face. We're going to try and improve these things. She's going to look like she got burnt after our treatment. The best results are going to result over the next 10 days. Where we're going to get a lot of shedding of the skin. She's going to protect herself from the sunlight. She's going to keep her face out of the sun from now on. She's going to use good sunblock, maybe a little bit of retin-A at night on a regular basis from now on, and sunblock 70 every day. Okay, because the sunlight still comes through the walls. The UVA, UVB light still comes and still can damage your skin and age it. Okay, and the reason you know that is because if you look at your belly skin and look at your face skin, it looks much more younger in the belly area, right? Because it's covered from the sun on a regular basis. So that's how we're gonna do it. So I'm gonna show you what we're gonna do today. We'll get the Erbium resurfacing laser. We do use a vacuum because otherwise it smells like a barbecue. And we want good results without anything scary. So, cool. And then we'll put some ice packs on your face to take the heat out. Okay, but you're gonna get red and you're gonna peel for like 5-6 days.
I didn't peel too much last time.
Well, we're gonna turn up the notch today, this time a little bit then.
The first time I did, I peeled for days.
You're asking for it. All right. Foot pedal and a hand things. You don't have to put your face any more coldness on your face, okay? Mm-hmm. All right, and all the stuff of the anesthesia was washed off?
Yep.
Okay. So just be close around and you'll follow me, okay? Nice energy because she has fair skin, and so we want to make her absorb as much of the energy as possible. But as you can see, where her face is already treated because she's already getting red, particularly on her forehead. Chin up. Good. So look at the top of her forehead. See where we did it? It's red. It's ablated, and over here it's not. So that's where the goal is, to get it just like that. We're destroying parts of the epidermis so the dermis can regrow all the cells back on the skin. She gets baby skin on her face. That sounds good, huh, man? Okay, I'm gonna switch over. Okay, so she's gonna peel a lot, even though she didn't peel very much last time, because you can tell by the redness. Okay. This can be pretty deep, so I always try to emphasize one pass with touch-ups, and we'll see how she does, but I think she's going to peel heavily. Cool. All right. And that's good. We're done with that. You go ahead and turn off that one. Then I'm going to say a couple words. Erbium resurfacing laser treatment. We're going to put a cool ice towel on her face now to try to dissipate some of that heat. We're going to get a lot of moisturizer, like 3 or 4 times a day, to make sure you absorb it, because you need a lot of moisture. Okay.
What should I put on it?
You can use a nice emollient cream of your choice. We have a few that we carry up there. I like moon cream. Okay, so the Hawaiian moon cream is really good. It's really water heavy and absorbs directly into your skin. So I like that one. Some people use Aquaphor. I think that's okay. I think you can use like, no. So for these type of treatments, we do Erbium resurfacing laser for your face. These are treatments you want to do in the fall, the winter, and spring. You want to avoid the summer because of the amount of energy that's dispensed and the sunlight exposure, because you get a sunburn on top of it. But some patients do come in the summer when we try to make sure they use a lot of sunblock, like 70 every day. They use hats every day, and they really understand the treatment. They've done it a few times. They really know what they're getting. This treatment will probably be good for a year overall. Sometimes people come in for a touch-up in about 6 to 12 weeks, which is not uncommon. It just depends how much energy they've gotten into their skin, how much sloughing off they get. The goal is to have her skin rejuvenate and repopulate new cells in all those areas that we've treated. Another option for patients would be is to do a plasma facelift. And plasma facelift is we take your blood, spin it down. We get the proteins, the growth factors, the white blood cells, and the platelets, and we inject them and create basically a human tissue visco supplementation for the skin. So it'll fill the skin like the tear troughs, the diagonal, the forehead. Over here along the sides of the forehead, we get the gaunt appearance. The pre-jaw lines will be filled too. But we did this like 6 weeks ago, and you can still tell it's working. Do you notice that? These are still filled in pretty good.
Yeah.
So I can tell because those are nice and filled in. So those are treatments you can do in lieu of getting a erbium resurfacing laser. YAG lasers or erbium resurfacing are much better than doing a CO2 laser because the amount of damage to the skin. It's easier to deal with the treatment, and patients recover much better, and they don't have a burnt face appearance. Any questions? Okay, let's get a nice towel for her face. Let's make sure it doesn't freeze.